Good morning, everyone. I want to thank you. Hello, everyone. I want to thank you for joining us for this EVV discussion. Thanks to everyone who is already on the group and has been faithfully supporting the activities for a little while now during COVID. And I also want to welcome the new folks that have just joined. If you've joined 5 minutes ago, which some folks have, or 6 months ago. I want to welcome you, and also want to welcome the folks watching on YouTube. We are also streaming on YouTube as well. Just a couple of things before we get started. I just want to make sure that our technology is working. It appears that it is. I do have a wonderful volunteer that will let me know if it is not working. So I appreciate her very much. Thank you so much, Heidi, for posting that as well. If you are watching on Facebook and you would like for us to identify you or give you a shout out, you'll need to give StreamYard the ability to do so. So Heidi Fernandez just put this link. You'll need to click that link if you're watching on Facebook. You can always, of course, remain anonymous. I will see your questions as well. And so again, I want to just go ahead and get started with a couple of ground rules. We're going to take questions from family members on EVV first. If we don't get questions from family members, then we will open it up to others, but we like to keep the discussion focused on EVV. And so without further ado, I want to welcome Brian Dowd from the Department of Community Health. And I do have some questions, but I want to open it up to questions. So go ahead and give a shout out. One of the things I've learned in the live streams over the last year is that there's a little bit of a lag. So it takes a little while for folks to actually catch up to what we're saying. So again, welcome on YouTube, welcome on Facebook. This is an open forum regarding electronic visit verification, EVV, with the Georgia Department of Community Health. So welcome, Brian. I think we're going to just go ahead, and I have some questions. And feel free, everyone, jump in with questions, post questions, and we're happy to answer them for you. So one of the things that I noticed, Brian, is that the trainings, and I have the trainings. All right, someone says they can't enter Facebook chat. You're entered. You're already entered if I can see you. You're there. You're there, Sharon. Just type your questions in. So one of the things that I noticed on your EVV training page, and I'm pulling it up right now, you have an extensive number of trainings. And one of the questions that family members have posted on this page before, hey Mitzi, hey Deborah, yes, we'll be talking about some other things as well. Who are the trainings focused towards? Are they focused towards providers? Are they focused towards family members? I have been on one of them, I think in January, and it didn't seem quite relevant. So please let us know who is the target audience for the trainings that are listed on the website.
Well, the trainings that are available on the website are for everybody. There may be some things as a participant-directed family member or a member to one of our waiver programs that you're not that interested in, because it's more like behind the scenes that your fiscal intermediary will handle. So I could definitely see going on there and being like, well, I don't know, claims matching processing really doesn't mean anything to me. But we want to make sure, I have been since 2018 working on EVV, and I have kept the same mantra throughout. Everything is going to be fully transparent and open to everyone. Nobody is going to be able to accuse me of not being fully transparent and open on everything we do. So all presentations are open to everyone. All town halls we've done is open to everyone. All presentations are posted on the website. All recordings of presentation are posted on the website. So we encourage family members to be fully aware of what's going on with EVV. We want you to know the ins and outs of the system. But there will be those portions that are targeted more to providers than to members.
Okay.
So when it comes to and just one other thing, when it comes to fiscal intermediaries and the participant-directed population, Our goal is not to disrupt how services are being delivered now. That's our goal. Our goal is not to make folks sign into multiple systems. Our goals are not to, because you may or may not be aware, but this is something we've been saying all along. EVV is only for community living services or personal support services. It's not for community access group. It's not for community residential alternative. It's not for community access individual. It's for community living supports. And so if you have that service array on your line, on your prior authorization or in your plan of care, we don't want you to have to do multiple things for that plan of care. We don't want you to have to go out to TELUS and then also go to your fiscal intermediary system. So that's why we're working very hard behind the scenes right now to have those fiscal intermediaries interface with TELUS so you can just continue to do business as it is now and not see any difference in how your services are delivered.
Okay. So that is helpful because sometimes, again, those trainings, it's great that they're listed, but I felt that they, as a family member, that not all the information was relevant to me. But I'm glad that you're keeping it open for whoever wants to participate. So it looks like we are getting quite a few questions here. I want to go back to something that you just mentioned, though. So EVV is for CLS and personal support services on the now and comp waivers. Any other waivers where there will be required?
All the waivers.
All the waivers. ICWP?
ICWP, CCSP, and SOURCE, which we now call the Elderly and Disabled Waiver Program. And it's also a mandate for the Georgia Pediatric Program. So we do provide personal support services to severely disabled children through our GAP program, in addition to skilled nursing. Those are also required to be compliant with EVV. So the federal mandate is anywhere there is EVV, you must comply with anywhere there is PSS delivered or CLS delivered, personal support services, you must use an EVV system.
Okay, so again, the ship has sailed. We must use the system. It's mandated in all 50 states, and the deadline is July 1st. That's the hard deadline.
The deadline was actually January 1st.
Right.
And we are a little behind in implementation. The system will be fully ready to go April 1st. It'll be fully ready to go on April 1st. And what we're going to do is we're going to make sure it's up and running. And we've got some people already signed up to use it. And we are going to be encouraging everybody to use it between April and July. Come July 1st, claims must go through the EVV system. So claims processing will become mandatory through the EVV system as of July 1st. Okay.
So if we are with a particular fiscal agent, we are going off what their deadlines are, correct? Or their deadlines are the April, July as well? I mean, yes.
Their deadlines are going to match up to our deadlines.
Okay.
But again, for you guys, you're going to continue using the system as it is now. So it'd be interesting to hear from you guys' perspective what the differential is that you're being presented with from fiscal intermediaries associated with EVV. What's your processing that you're going to do differently now that you're being told is going to be different as of July 1st?
Okay, so I think we're going to hear that, Brian, which is great. And I do see that someone may have joined us, but I'm going to, Robin, if you want to jump on, I'm going to get to you. But I do want to look at some questions here that we're getting because it is a hard shift for us. Brian, I'm just going to speak for myself. I still use paper timesheets for CLS, right? And so working with my fiscal agent, make that transition. They've presented a couple of options, but others are mentioning that as well. Before I go into that, and I will go into that, I promise, I just want to recognize that we do have Continuum that is actually joining us in just a little bit. Robin Sims. Public Partnership I reached out to, was not able to receive a response from them. Acumen said, Rita, we love this idea of the interview. Please follow up with us in a couple of weeks. So that is a strong maybe. So just letting you all know that there may be another one. Let's go through some of your comments and I will. All right. So Heidi Moore says on YouTube, thank you, Heidi. When are participant direct families going to be trained by their fiscal agents on their options and how to enroll? Is that a question that you can answer for us?
Between now and July 1st.
Okay, between now and July 1st. Debbie Hibbins says, I assume you'll be specific about what's different about Acumen. And yes, we will talk about that so that Brian is aware. Just a second. Francis from YouTube says, I'm a mother of a special needs adult child. Is EVV applicable for CAI, CLB? No for CAI.
Again, only
No for
community
CAI.
living supports. Only
Okay.
community living supports. Let me
Okay.
say it one more time. Only community living supports.
Yes. And, you know, again, sometimes as humans, we need to hear things like 5 different times, 8
Exactly.
different ways.
I
So
gotcha.
it's a fair question.
I've probably answered that question 1,000 times in the last 2 years.
So maybe
And
a
that's not an
t-shirt,
overestimation.
maybe we put a t-shirt, Brian, you have that on the next interview or something, or on your banner down
Yeah.
here with your name.
Well, it is, just so you guys know, everything I'm telling you today is on the website. Nothing I'm going to tell you today is different than what is already posted on the website. So we do have a chart on the website that specifically lists the services that are covered and by what program. So you can go on and see, because we call things different in different programs, right? So you can go on and see now in comp and it'll say community living supports. And then it'll say now in comp, participant directed community living supports. And then there'll be EDWP, which is the elderly and disabled waiver program. And it'll say personal support services, right? But then we realized that people were like, okay, I see that chart, but I still want to know, is community access group covered? So we made another chart that said none of these services are covered. And we actually went in and listed every other service out, just so people would have it in writing so they could look and see and say, oh, community access group is not covered. Because I quickly realized just saying what was covered wasn't as powerful as saying what is covered and what isn't covered.
Yes, and change is hard. I understand that. So again, I appreciate you being on today because this is another avenue of education. So for Francis, CAI, no. CLB and CLE are CLS, so that is a yes. Respite and not CAG for now waivers. That's a no. Okay.
Nope.
All right, good. All right. So Francis says, where do we find these trainings applicable for now waiver parents? You talked about that a little earlier, that all the trainings are on the DCH website. If I could figure out how to post this link real quick without losing everybody, I would do that, but I don't want to. I may post it later so that you can see them because you have an extensive website for sure, DCH.
But let me tell you the easy way to do it, because y'all aren't going to believe me when I tell you this, but it's the truth. You know how I get to our EVV website? I pull up Google and I put in DCH EVV GA, and it's the first thing that pops up. So I know I should have it bookmarked, but I don't, because I want to make sure that it's easily applicable by a search engine. So if you just go to Google and put in EVV DCH or EVV GA, we're going to be one of those top 2 or 3. We may not be the first one, because some companies have gotten really smart and decided they were going to put an ad over us for like assisted technology or an EVV system. So they've put some ads. So just make sure when you look at it that it's the Department of Community Health site. Okay. It's pretty easy to see because the ones that are ads have little notes that say ad, and ours doesn't.
Okay. And again, the trainings are open for everyone, and some of them may be geared more towards providers.
They are going to be, and
Correct.
they are going to
Yes.
be more geared towards providers. That's very fair, because for our perspective, we're trying to work with your fiscal intermediaries to be the providers of their third-party EVV system to connect to our EVV system so that we don't have a big disruption in the way you guys do service. I do hear that some of you guys, like Rita said, she's still using paper timesheets. Unfortunately for EVV, we do have to meet the federal mandate of the 6 required services that have to be collected electronically. So we will have to move folks to some sort of electronic method of doing it. Just so you guys know, I, on 2 separate occasions, have had the conversation with the federal government and the Centers for Medicare and Medicaid Services about, is participant directed applicable in the same way as traditional providers, or should they be treated differently? And it was emphatically that participant directed members should be treated exactly with the same rigor in EVV as a traditional provider. There were no exceptions for the participant directed members. Because I walked through some of these concerns and issues that I had been hearing about from you guys. Because remember, I've been doing town hall meetings since 2018. I've been traveling the state talking about EVV since 2018. Savannah, Augusta, Tifton, Macon, all the places in Northwest Georgia. I have visited on Northwest and Northeast Georgia. It's amazing how it's not really easy to get from Northeast Georgia to Northwest Georgia. It's easier to come back into Atlanta and go back up. I made that mistake. I've been all over the state and I've heard a lot of your concerns. So we did address them with the federal government, and we were not given any latitude in the implementation.
Okay. So I do see that there are 2 people on from Continuum, and I'm wondering if they would like to make a comment before we dig deeper, but I don't think that they know that they're on camera. So let me just see if I can add Robin. Robin, you are on camera. If
yes,
you could unmute yourself.
Yes, I did. Thank you, Rita. Good morning, Mr. Dowd. I'm on camera because I promised you we will be on it. I've got Shanae Bostic who will be sitting in for me.
Okay.
I have another emergency meeting that I've got to go to. So she's going to sit in. But right now, just on my comments regarding EVV, and I'm just going to be real honest and candid, it's called major confusion. We know what we have to do, and we're working on getting that done now. But it's a lot. And we understand what Mr. Dowd said about the mandate, and we'll be working toward making sure that we meet that mandate. But it's just a lot of questions that people have. We understand about the GPS system, but from continuous standpoint, we have a lot of people, and we're just having to investigate whether they even have smartphones. And that's been a big issue because some of them have flip phones. And with the flip phones, they're not going to be able to get the EVV app on those phones. So we're trying to figure out what measures we can take to try to assist with that. And that's just the fundamentals of what they need even to go in. The second piece is just whether they would understand, that you're going to need to be on site, or we'll be able to track you if you're not on site and you're clocking in. And understand, Continuum understands that this is a big issue. We got a call about a week and a half, 2 weeks ago from someone who says that people are literally putting in timesheets that are not showing up. So we understand the urgency for this to be done. It's just trying to bring everybody who might have limited skills up to snuff with this. And that's where the difficulty is going to be at for us. We have some that can't even put in timesheets properly.
Well, Robin, I just appreciate you and Continuum being here today and being a part of this conversation. As you said, you had an emergency meeting to go to. Is there anything else that you'd like to say? We've got roughly about 90 folks watching us live. 90, we do.
90, okay. Well, we're going to be up to the challenge.
To say?
We're going to be up to the challenge. I have Shanae Bostic, who will be on the phone in my stead, who will be answering questions. And, should you decide to interview her, she'll be going through some of the things that we are setting in place and what we are doing.
Thank you again so much for your time. And I'm going to bring Shanae on in just a sec.
Okay, great. Thank you guys
Thank
very much.
you.
And I
All
do
right.
apologize. Have a great one.
Thank you. Shanae, just want to welcome you from Continuum. We are going to go through questions. Robin just spoke, as you saw, but I just appreciate you being here so much. And we're going to continue going through some questions. And as folks have direct questions for you, we'll call on you as well. So just know that. So feel free to put yourself on mute.
Okay.
And I will get back with you.
Thank you.
Okay. All right. So let's go. I'm going to run through some of these questions here. Another big question is on the facial recognition. And so I'll just give you my experience, because I think folks have a lot of folks have this particular fiscal agent who's not able to be on today. But anyway, so their options are several, which I think is good to have several options. One is for staff to download the app on their phones. And then what would happen is when staff arrived, I would type in the last 4 digits of my son's social into their phone and then clock out the same thing. So that was one option. Personally, I'm not a little comfortable with that. Okay, so yeah, I'm not comfortable with that. Secondly, there was the facial recognition option. So I don't think my son's going to be comfortable with that, and it's just not practical. So we looked at, I don't think that may not work for us either. There's another option, and that is to do it through a landline. So when a person comes in, they clock in through dialing a specific number and using their employee specific code. Same thing when they leave. That one I think I'm a little bit more comfortable with. So I just want to hear from others. I think that is a big concern, is the facial recognition. That's what I'm seeing here. Let me just quickly, Brian, are you aware, since the state is not requiring facial recognition, what are the in and out punches? Okay, this is the one that we needed some more clarification on. I think it was from Tammy. She put that on at 12:05. Since the state is not requiring facial recognition, what are the punch in and out options when the CLS direct support staff, I'm going to put it on here. There we go.
Oh, look at that. That
helps, right? That helps, right? Yeah. Okay. So what are the options here when a direct support staff takes the client to participate in a reoccurring CAG program activity with the required real-time punches? With Acumen, the only option with their DCI EVV is the facial recognition, or employer has to be present. So we're just making you aware of this. Don't know if you can necessarily answer this, Brian, at this time. Yeah.
So I guess the question here is, and so let me start with this. Nothing that is mandated from the state is about facial recognition. So I want to back us up a little bit. What is mandated by the federal government is that you collect 6 things. You collect what is the service that's being collected. Let's see if I can figure this in. Check in, check out. Who's doing the service? Who is receiving the service? I'm missing something.
So that's what the state requires. What if the fiscal agent says this is our way and it is EVV compliant? Then what do we do?
So there should be a host of options, and I know with DCI there is, and Acumen, and we're having this conversation with them tomorrow. Okay. Their options are, what's not an option is, we're not going to do any of these. So let me make that clear, that if you want to continue to get paid for CLS, you must be compliant with EVV. Because if you're not, guys, we're going to get a penalty with the state that increases and increases and increases in state funds, which means things are going to get cut, right? I'm just trying to be as honest with you as possible. We have to figure out a way to make this work. So I get the angst, I get change is hard, I get all of it, but we're going to have to figure out a way that there is an option that works good, right? So let's say we don't like the app for whatever reason. You have to use the social security number, or you just don't have a smartphone like Robin was talking about, you don't like the app. I personally would not like facial recognition. I don't like being on this camera right now. I do not like facial recognition, and I have said that since the beginning of EVV in 2018, that I think it's a bad option for us, for members. I mean, who wants to check in and check out with your face every day? Not me. Third option,
Yeah,
IVR.
No, good.
So then you have to use an IVR. But we have to get to a space, folks, where we are trying to work with this and make it work. We just have to, because the option of not working with it is not a good option for the state. The state penalty gets higher and higher and higher that we have to backfill with state funds. And we get a corrective action plan from the federal government. This is a mandate. So if you have issues, I'm assuming the issue with the smartphone clock in, clock out is you don't like putting in your last 3 digits of your social security number, or what is the issue with the clock in on the app on the phone?
That the way to do that is only through facial recognition and typing in the last 4 of the social, and the employer actually has to do it themselves. So that's a challenge. So I'm glad we're having this conversation.
So that's something we will have to have a conversation with Acumen, which we have a meeting with them tomorrow, because that's not my understanding. My understanding is that they use the last 4 digits of the Social Security to check in, but not that it is combined with facial recognition.
No, it is not combined. It is
Okay.
either one or the other. So I don't want to misrepresent that either. It's one or the other. And, you know, again, we're talking Rita here, so others are probably more tech savvy and don't, you know, whatever.
Right.
I'm more comfortable with a landline and my employee doing that, not my employee, my son's, you know, mentor doing that when she checks in and checks out. And she's more comfortable not having another app on her phone. That the whole issue of the GPS is another concern as well. And I'm wondering if folks, I'm just scrolling through some of these comments, and folks, if I miss one, all right. So this is an Acumen question. I don't think that Brian can answer this, but I'm going to ask it anyway, Heidi, because you're volunteering your time today. So
it's also just good for me to hear. It is good for
okay.
me to hear these as well, because, like I said, we do have a meeting with Acumen tomorrow.
Well, then this is perfect timing. So with CAI, CAG, which are not EVV, they don't fall into that umbrella, can we still use paper timesheets?
So I believe with CAI, I don't know. That's something I'll have to ask them. I can bring that up tomorrow. We don't have anything where we're requiring anything other than CLS or PSS to be done electronically at this point. I mean, and I can be honest with y'all, Congress may come back and say all home and community-based services have to be done through EVV. We've seen other states where they have implemented EVV for personal supports, and then their own state legislature has come back and said, wait a minute, y'all saved $3 million in fraud, waste, and abuse just in this one waiver. We need to expand that to everything. Arkansas is an excellent example of that. They've expanded it to non-emergency transportation, behavioral supports, a whole bunch of different things, right? So I can't speak about the future, but I can tell you for this implementation, all we are mandating is for CLS in Now and Comp. And I will certainly ask them about that tomorrow, if they are mandating it for everything or if folks can continue to use paper timesheets for the other services.
And what they told me is that they were mandating it for all services. So I'm just a little confused. Yeah. So thank you. Like I said, this is a perfect timing for this meeting. Let's see. Is there different? I'm going to go through here. Libby says nothing for nothing. I'm assuming that means agents. Heidi Moore says, let me just say, please verify families that are currently using Acumen DCI software with web time entry is not EVV compliant.
Please verify if
So-
families that are currently using the Acumen DCIs with web time entry is not. I don't, Heidi, I don't know, but I can certainly go back and talk to Acumen about that tomorrow, because the conversations we've had with Acumen have been very clear that their methodologies are able to capture the essential components that are required by EVV. So I don't know of any point where they're not doing that, because what they're attesting to us as a provider, which all third-party providers have to do, is they sign an agreement that says our system meets the minimum requirements and does the following things. And by the way, that too is also available on our website. So you guys can go look at what that attestation form is that a third party has to submit to. So I will bring that up to them. I don't know.
Okay, so we've answered this. What services are under PSS? Is speech therapies and any other services under PSS? And the answer to those therapies are no. It is
No,
not.
only-
Okay.
Yep. Only
Let's
PSS
see here.
CLS.
Anything? Okay, it looks like we're getting another comment, a question about the EVV compliance with the DCI software. So it looks like we'll get some clarification on that. What is the website? So I posted the website in the chat. So hopefully I was able to do that as Brian was talking. Hopefully you'll be able to catch that. All right, Mitzi asks, so we are saying all codes, we will not use EVV. And Brian is saying yes, right? It is just for personal support services, including CLS, but not CAG or CAI.
It's only mandated
Okay.
for CLS. Now there are, I think, 32 codes and modifier combinations for CLS, but yeah, not for any of the rest of the codes.
Okay. All right. And Francis says, again, what's the URL for the website? Check down. I've posted it and I'll post it afterwards as well. And, or just as he said, do a Google. I mean, when all else fails, do a Google. So EVV, Georgia, DCH. All right. Heidi
Yeah,
says, yeah.
I swear that's how I get to it. So let me, while we're talking, wait, let me not do that because I don't want to mess up something. So forget it. I was going to try and do it because sometimes in the trainings we do, the town hall trainings, I just take control of the system and show people, here's how I get to it, and show them that it's like the number one thing to Google on.
Okay. Brian, Heidi says, okay, you are saying that the Acumen app will only allow us to use CLS, but we will have to enter CAI with our employee in a different format. Wow, that's a complicated question. So CLS, yes, yeah, you have to, it's mandated, but CAI, you don't know yet, right?
I'm not saying how Acumen runs their system. So what we will make sure that Acumen, that you've chosen as your fiscal intermediary, we will make sure that they increase their communication to members, and we'll have this discussion with them. I'm not regulating what they're doing with CAI because it's not part of EVV, right? I'm regulating what's going on with EVV. Now, they, as a fiscal intermediary, may have made a decision that as an offer to you guys as a fiscal intermediary, that they want all of their services to go through their DCI system. That may be what they're saying, and that everybody needs to start using their DCI system rather than having paper timesheets and using the computer, both. Because if I was running a fiscal intermediary, I wouldn't want that either, right? Because now I'm doing twice the work, right? So I don't know if that's what they're saying, if they're saying that everything needs to go through that, which I understand if they are. And we will have to have that conversation about how they're communicating that out to individuals.
Okay, so on YouTube, Latanya says, please verify families that are using the Acumen DCI software with web time entry is not EVV compliant. They have to be live punches, correct?
You have to have an electronic clock in and clock out.
Yes, okay.
Or you have to go in and do it administratively via the web portal, or you have to use a fixed device or a landline. That's what we're doing in this state to be EVV compliant.
Okay. All right, let's see here. Okay, here's one. Self-directed home with 3 adults providing CLS services for all 3 at the same time. How to handle EVV?
So help me with this. You're one worker who is providing shared services for 3 EVV members at the same time.
Jane, let us know. Is that correct?
Or are there 3 workers that are working with 3 people?
I'm going to guess that there's 1. So what if there's 1? And I'm not seeing Jane. It takes a little time to get a response here. So let's go with 1. What if, hypothetically, what if there's 1?
So
Jane says yes, there is 1.
So those codes would need to be loaded for each of the members, and you would need to clock in and clock out for services with the members, all 3 members.
Okay, so there's going to need to be a clock in for all 3 members.
And it would need to be with the shared services CLS line. So I'm going to take that back myself because, and here's something else, guys. I've been getting some questions that have been giving me pause, right? I've gotten questions in the last 2 years from self-direction that have really made me go back and ask some questions on our end. So that's an excellent question. I know there is a shared service, so we will go back and look at that question, and we will get some specific guidance on the website about it.
Okay. All right. So Libby says, will there be an override or correction method in case of signal issues, someone forgets, etc.? That's also a good question. Thanks, Libby.
Absolutely. So I tell the story in the town halls all the time that I used to get written up when I worked at a record store many years ago. When I was a kid, I always worked at a record store from the time I was about 16 till I was through college. And I was terrible at clocking in. I would forget, right? You get into the record store and you're like, what do you need me to do? So I would start doing work and like talking to people and helping people find stuff. And then I'd be there like 45 minutes and I'd be like, oh, shoot, I never clocked in, right? And so there was a way that our company could go in and correct my clock in. There is that availability as well on an administrative portal. Now, I'll tell you this too. Please, I think we need to remember why this system, why EVV became a mandate, which is that Congress was presented with the fact that what they assumed based on studies with EVV and verified was there was a lot of misuse of taxpayer funding associated with home and community-based services. Now, I all the time I get people who go, that's just not true. That's false. And that's your reality, right? Your reality is, and I'm guessing all 90 people on this call right now are incredibly careful to try and pay attention to what the rules are and follow the rules exactly. But not everybody is, right? So if we will have standard reports that come out of this, if every single time you clock in, there's an exception code or some sort of code that you're having to use to override, we're eventually going to have, okay, well, why is it that every day there's an exception code to you clocking in? We're going to have those questions, whether you're a traditional provider or whether you're a self-directed, participant-directed member. We're going to have those questions.
Okay. All right.
It's the whole point of the program. The
Right.
whole point of the program is to reduce fraud, waste, and abuse. I have been preaching the quality benefits of having this system over and over again. But the reason it was mandated by Congress is they went and put it in Florida in a couple of counties, right? And they had tens of millions of dollars they identified as being inappropriately used.
So what is there a statistic on the percentage of fraud here in Georgia? Do we know? And then I'm going to go to Continuum. We have a question for Continuum. So I'm going to add Shanae back to the screen.
There's really not. We don't do a tremendous amount of overall fraud work in the state of Georgia. We have an Office of the Inspector General. We have, unfortunately, prosecuted traditional providers and self-directed members. So, for fraud. So we definitely, but we don't have statistics on how prevalent it is other than what we have seen, which is pretty consistent in every state. I talked about Arkansas before. And Arkansas, once they started seeing the fraud, they expanded it to everything in home and community-based services. And they had a pretty lax auditing and fraud detention department. So it was a real surprise for them.
Okay. Let's go to Shanae real quick. Shanae, again, thank you for being on, representing
no
Continuum.
problem.
We've got a question here from John and Maryland. Can you tell us Continuum's plans for EVV?
Right now, we are in the process of getting information out to our families to see who actually have the capacity to even download the app. I know that there's an app, and we do have somebody specifically working on the EVV project, but he's out of the office today. So I'm kind of just filling in. But we're in the process of sending out communication to our clients, to the families, to see who have smart devices. And so we're going to go from there. And then I believe Michael is, he's working on our IT department. We are working with TELUS. We're going to go with TELUS. We don't have a third party, so we're using the vendor that the state has chosen. I don't believe there's anything that our system has to do differently other than, I'm sorry, I'm on my phone, so I keep getting all these notifications that come up.
That's all right.
It's okay. But yeah, right now we're trying to get communication out to our families. So that's where we are right now. As far as the details of where we're at with implementing the EVV, I would have to speak with Michael on that. He's the person that we have working on that project specifically. But, we'll get that information out to our families and kind of go from there.
So let me also say that we have met with TELUS with all of the fiscal intermediaries now. We have set up working groups with all of the fiscal intermediaries to hear their concerns, to figure out ways that we can't connect, or in like Continuum's case where they can't adopt the EVV platform, so then it can be used for their clocking in and clocking out for CLS services.
Okay, so it sounds like Continuum, you are on board and you're looking to make that shift to implementation, and you'll be communicating out to your clients.
Yes, ma'am.
Very soon. Okay. All right. Thank you, Shanae. I'm going to put you back on pause.
Okay.
Okay. All right. Here's another one from Facebook. This is an extensive one here. What happens if the punch location, which is based on GPS, is not a location input in the EVV employer portal? Example, my employee clocks in and out at our client's home, but all the punch detail report in my employer web portal EVV map an address across the street for all punches. It remains inaccurate until I submitted a correction to Google Maps system. Okay, this is really getting down into the weeds. So Brian,
it's a really good question though.
Yeah.
Because it's kind of part of a broader question, which is that there's this notion that EVV has to start and end at a person's house, right? At the location we have on file. That is not true. It's just not true. So we've been doing this a long time too in the state. We understand that not all services start at a member's home. And we understand that sometimes people start members at grandma's, or they start member at their brother's house, or they start member at their son's house in the elderly and disabled waiver, or at CAG, like we talked about earlier, or wherever. We also understand that, it might, like I'm at 4743, right? That's where you see me at now. And what was funny is I ordered food yesterday, right? And I don't know how, but it got sent to 4742, which is my neighbors across the street. I don't know how that got mixed up, but the neighbors across the street knew who I were and were like, no, you're going to Brian. He's that house over there. When we have EVV, we have a fence around what we know as your home address that is like a radius around that. If your Google map address is showing at across the street or at the end of your street, that's not even something that would trigger, okay, this is a new location. But even if it was at the Kroger, we're not still going to stop. The system's not going to stop claims payment or say that something's wrong. But let's think about what I said earlier, right? If every single time you clock in and clock out, it's a new location, then that may cause us to go, wow, either this person is really out there in the community and that is fabulous, or something's going on here. This is funky, right? They're never getting services at home. They're always getting services somewhere else. If they're clocking in on 285 and you live in Stone Mountain and we know you're on 285, and that happens repeatedly over and over and over again, then it may beg the question as far as, wait a minute, why is it that this member is never getting their services started at their home, but it's always in some variation of 285, which appears to be on the way to the member's home, right? That's how fraud, waste, and abuse things are looked at. So there's nothing in the system that is going to prevent claims payment if it's done across the street or next door. The fence we do is several miles around the home address to click off something that's weird. But even in the event that your address clock in and clock out isn't your known home address, that's still not something that's unusual to us. If you're clocking in and clocking out 3 days a week at the same CAG address, then that's normal. That's normal processing, and that we won't be confused by that. Okay. So that's kind of all that data analytics that goes into an EVV system.
So, and we know that the telesystem does not have a continuous GPS, so it is not tracking that individual after their shift.
No, and there's just, in order to track somebody like during a 4-hour shift, it's an incredible amount of data and cost for a state to do. No state is tracking people throughout the day. All the states that I've spoken to, which are most of them, and one territory, believe it or not, I'm friends with the people in Puerto Rico, that it's only capturing the moment you check in and the moment you check out. And I've been asked on webinars a million times, well, what if my worker, after they check in, shuts off their location indicator on their phone? You know what? I don't care. Knock yourself out. If you want to shut off your location indicator on your phone after you've clocked in and then turn it back on when you clock out, that works for me. We're not tracking you anyway during the day.
So here's another question someone had posed to me. They had purchased an inexpensive tablet on Amazon. I think it was $30 or so. Can they load the app onto that and it stays in the home so that the employee doesn't have to add an app to their phone, etc.? Does it have to? Yeah. I'm
almost positive that will work. Okay. Not the desktop like I have here, not my desktop,
right?
But an app like an inexpensive phone, like an iPad. I wish mine was within reach. My understanding is that will work.
Okay. Okay. So that's good. Good. All right. So here's a question, Deborah, but we did address a lot of this earlier. So just replay. The only option is there are other options besides downloading the app. Landline, yes, with Acumen. I will be asking them for an interview. They wanted me to check in a couple of weeks. Can a desktop be used to punch in and out? Brian is saying no on that.
So there is an administrative portal,
That's right,
but
Brian.
Yeah, it's generally used, the administrative portal is generally used for exceptions. It's not used for a daily clock in and clock out. Deborah, this is a good set of questions. We did talk about this a little bit earlier, and Heidi's correct in what she is. Heidi, I just called you Heidi. I'm sorry. There's, I got two Heidis on, and so forgive me, Rita. But anyway, so we have a meeting with Acumen tomorrow, and we're going to talk to them in that meeting because I think we need to ramp up the Acumen's communication with you guys as far as what are the available options and what you're available to use if you're not comfortable with the app.
Okay. Victoria on YouTube says, is there going to be reimbursement for purchase of device to clock in and out? I believe you answered that on the first interview that we did, and the answer was no. Is that correct?
Nope. It's precluded by CMS.
Okay. Okay, so this is another, we may have answered this. If we are not using facial recognition, who puts the social security number if the employer is not present when time starts? Example, picking up from a day program at start of shift. That is maybe a fiscal agent question, or?
Yeah, I'm assuming in that scenario, it would have to be the staff. If you're not there and the staff
froze
member
for a
is
second.
Oh, I'm sorry. Did we freeze? Do y'all see me again?
Okay.
Do you see me again? Let me know if we're good.
Let me put that back up again. Yeah.
Okay, sorry. For whatever reason, noon to 1 is always a little bit of a funky period at my house. So yeah, I'm assuming that, if you're not, if the family member is not there or somebody else is not there, then it would be the employee, the person you have hired. I understand you have angst about putting in that 3-digit social security number associated with the member. That will be something we discuss with Acumen tomorrow.
Okay, so I think when I pull over the questions, maybe that makes me freeze because people can see you. So Heidi says, strongly recommend pushing Acumen to start communicating directly with families ASAP. There's been no communication to families to date, is according to Heidi Moore. So let me go through. I think we've, if you have a question, now is the time to go ahead and ask it. I'm going to be scrolling up. There was one provider that asked a question, and just for the sake as this person participates in this group, I'm just going to see if I can find his question quickly and ask him. If I'm not able to, sorry, there's a lot of chat going on here. All right, Trent says, this is from a provider. Our payroll company allows us to enable location in for CLS. Our employees cannot punch in and out without their location showing the exact address we have in the system. Is this sufficient, or would we have to implement another program? That's from a provider.
If it does the 6 things that are in the system that are federally mandated, and you can see that on the website, there's no reason why that wouldn't work. I mean, I don't see why. I don't see from what you've put at the first part why there would be any problem there. Okay. If it's doing the location in and out, and it has a way of tracking who the person is that you're doing the service for, and who the member is, who's not the member, who the employee is, then you should be good.
All right, Dave Zilla says, does the term landline mean actual landline, or can you use a cell phone?
My understanding is it's an actual landline.
All right, thank you. Here's another detailed question. Let's see, from Deb. For CLS EVV, when client caregivers are in the home and then go to the grocery and come back, do they need to take the phone EVV with them, or can it stay in the home? We want to use a phone we supply. I think we talked about that on a possible tablet. Is that okay? Yeah.
For us, we're just doing clock in and clock out.
Okay.
So again, we're not going to be, if this is a time where they're not clocking in and clocking out, we're not going to be checking on location during that time anyway. So it wouldn't matter to us if the phone was with the person or not. Okay. Again, we're not tracking people throughout the day. So whether that phone is with them or not doesn't matter.
be freezing up again. Here's another question from Northwest Georgia. We have limited cell service with many dead zones. What if there's no service at the location of services? We also have many in poverty who do not own computers.
So the systems are capable of connecting your geolocation from clock in and clock out. Whether or not there is cell service that's available, it transmits when you get back into the cell service area. It's pretty standard functionality for these devices anyway. You don't have to have current connectivity for them to kind of satellite geolocate you when you clock in. That's not a problem. As far as people living in poverty, we have multiple options that are available for folks to use in order to be compliant with the federal mandate.
All right, so let's see. Isn't having the staff enter the code to clock in if picking up? I don't know. Isn't a staff? I'm not quite sure what that means. All right. How about this one? Nalini, is VoIP line allowed instead of a landline, I guess, is what she's asking.
I don't know the answer to that question. I will be happy to bring that back to our IT people at TELUS and with the fiscal intermediary I'm assuming this is an acumen question, and bring it back to them as well.
So Emily is letting us know that that's a landline meeting connected to Wi-Fi. So thank you for, all right. So can providers approve time from their desktop that has been entered by an employee on a different device?
Providers approve time from their desktop that has been entered by an employee. Yes. Yeah, I mean, yeah. So, and I'm going to encourage you, this is why I think it's important for everybody to see the functionality in the town halls and trainings that we've already been doing. So I'm going to encourage people to go back and watch those. Okay. So go back and watch on the website, what are the town halls we've done today? Because we did, I think it was the first or second town hall was about the functionality that is available on the app versus what's the functionality that's available on an administrative portal. So those two trainings very clearly kind of explain the interplay between the two and what the purpose of both are.
Okay. All right.
They will be, and as of next month, they will be existing trainings that you can pull up at any time on the system and review at your leisure.
Okay, folks, our time is winding down together. Here's someone is giving you some information for your meeting tomorrow, Brian. Acumen does not allow employees to verify in their EVV app punch. The employer has to be present for the punches or use facial recognition. Our hands are tied.
Okay. Gonna have to figure out a way to become compliant.
Okay. So folks, I just want to wind down, thank everyone. We have 94 people on. If you are joining on YouTube or on Facebook in the private group, thank you for being a part of this very important conversation. Brian, thank you. You know that, I mean, I don't know about others, but me, sometimes I need the hand holding when things are changing as they are. And so thank you for your patience with us and taking all these questions. Even though they may seem repetitive, I know I need to hear it again and again and again. So
let me just say this. Thank you for inviting me today. 2, totally get it with the repetitive thing. I have to hear things at least 10 times before it sticks into my thick noggin. 3, utilize the EVV mailbox. We have a specific EVV email address that you can write to, because if you're like me, even though I'm here telling you all this and it's on YouTube and it's recorded, I sometimes still want stuff in writing, right? I want you writing me back individually. Send me an email on that EVV website. We will respond to you in writing specifically with your concern so you have it. I looked yesterday, I have responded to 3,000 plus emails in the last 2 years from the EVV website. Over 3,000 emails. Every single email gets responded to. So I encourage you to utilize that resource.
thank you, Brian. I'm going to just bring on Thank you, Shanae, for presenting Continuum. We thank you for just hanging with us for the hour. I look forward to more conversations. Oh, she can't hear me. Okay. Thank you. All right. So Brian, I'm going to follow up with Shanae. But thank you again. And this has been a great conversation, and we'll continue the conversation. And everyone, hang in there. We're going to get through all this together, right? All right. You all have a great day. If you are, don't worry, this will be archived. You can watch it in replay on YouTube and on Facebook. So thank you, everybody. Take care.